In this video, we are going to talk about the use of whole-body CT scans on asymptomatic patients for detecting cancer. An asymptomatic patient is a person who carries the disease, but shows no symptoms of it. CT scanning is a medical imaging procedure that subjects the patient inside an isolated tube called the gantry, where multiple X-ray tubes and X-ray detectors rotate around the body to create a two-dimensional image of the body. This is more effective than X-rays, as it can effectively image soft tissues and bone alike, and can be further digitally altered and manipulated to show desired organs. However, this puts the asymptomatic patient at risk as high radiation doses are being used, therefore putting their health at risk. This is why there is a constant debate about whether asymptomatic patients should be undergo whole-body CT scans.
So should whole-body CT screening be used on asymptomatic patients for the detection of cancer? Let's break down some of the pros and the cons. Here are the pros. Utilizing whole-body CT screening allows asymptomatic patients to be made aware of any underlying diseases. This method is quite useful for patients who are aware of their family medical history, such as patients with a family history of lung cancer. By using these technologies, patients are placed at an advantage as they are then able to receive treatments to restore their health condition, as suggested by Wang et al. More specifically, the National Cancer Institute suggests that the whole-body CT screening may reduce cancer morbidity because treatment for earlier stage cancers are often less aggressive than more advanced and developed cancers. Another added advantage is that a low dosage of radiation is sufficient enough to provide a good diagnosis of the patient. This is supported by the International Commission on Radiological Protection. Ultimately, it can be assumed that whole-body CT scans are extremely helpful for asymptomatic patients who have a high chance of acquiring diseases such as cancer.
Although there are all these benefits, it does not outweigh the negatives. Are there any other issues for whole-body CT scans? In actuality, yes. The most compelling reason is that these patients are being exposed to unnecessary amounts of radiation. CT scans actually have a higher radiation dose compared to X-ray when you're looking at a full body scan. To add on, scans may make a false diagnosis. In a proposal stated by Bryanfield, Gazelle, and Wittenberg, 908 out of 1,000 screened patients would have a minimum of one false positive test, making their diagnosis misleading.
So, what if there are high radiation doses? What's so risky about it? Well, the high radiation exposure from high ionizing energy from multiple X-ray tubes can result in malignant and benign tumors being formed. Although incidental findings may be found, the risk of harmful tumors can lead to asymptomatic patients displaying symptoms of cancer. However, radiation dose can be minimized by reducing the area of the scan, not performing a whole-body CT scan, and by also lowering the dose levels relative to the patient's size.
Additionally, CT scans are so expensive. A clinical trial for whole-body CT scans added up to about $2,513 for each patient. Out of all of those who supposedly show symptoms, only 2% were actually diagnosed. The scans for the false diagnosis used up to about 32.3% of the total imaging costs. Using it to discover early signs of a disease can actually increase the risk of getting cancer-like symptoms because of the radiation itself.
But what about the expensive cost for the maintenance of the machine? Since whole-body CT scans require the prolonged use of the CT machine, multiple X-ray tubes are also used over an extended period of time. The prolonged use of the X-ray tubes can result in overheating, causing damages to the fine parts of the tube, such as the anodes for instance. This is costly to replace and further expensive to maintain all multiple X-ray tubes in a safe and stable working condition. So what is the final verdict? Overall, the whole body CT scan should not be used for asymptomatic patients. There has been no evidence so far that proves that CT scans for asymptomatic patients will improve their survival rate. Therefore, it is not worth the time, cost, health, and medical imaging resources, since given the high radiation dose can lead to the patients displaying symptoms of cancer themselves despite being asymptomatic.